Namaste. Today I am going to talk about the bone that is the sacrum. Now this sacrum is formed by the fusion of the five sacral vertebrae. The five sacral vertebrae fuse together and forms a single bone. This is a single bone that is present, which is known as a sacrum. Now this five sacral vertebrae fuse together and forms the shape of this bone. This bone, which is the shape, is the triangular shape and it is a wedge shaped. Now it has been divided into the different surfaces. This portion which is present here, this portion is known as the pelvic surface, and this portion which is present here, this portion is known as the dorsal surfaces, and then after that there is a present two lateral surfaces which is present here. Now the features that is present in the ventral surfaces. Now this is the ventral surfaces which are known as the pelvic surfaces. The features that is present here, it is formed by the fusion of the five sacral vertebrae. Now within this fusion of the five sacral vertebrae, there is a present line. You can see the line which is present here. This line is known as a transverse sacral ridge. This is the line which is present here. This line which is present here, this portion is known as a transverse sacral ridge. And this sacral ridge denotes the fusion of the sacral vertebra. Now to the lateral to the sacral ridge, the transverse sacral ridge, there is a present this foramen which is present here. This foramen is known as a sacral foramen. From this sacral foramen, there is the emergence of the ventral rama of the four sacral nerves. Now then after that, when you go to the laterally, there is a present this prominent part which is present here. This portion is known as a lateral mass. When you come upwards, this portion is known as the base. This portion is known as the apex. Towards the base, you can see this line, the anterior margin that is present in the first sacral vertebra. This portion is known as a promontory. When you go to the lateral to the promontory, there is this wing-like structure that is present. This portion is known as a ala of the sacrum. It is like a wing shape, that's why it's known as a ala of the sacrum. When you go to this area, there is a present this area which is known as a lateral mass. And this lateral mass get articulated with the hip bone and forms the joints, which is known as a sacroiliac joints. When you come to this area, you can see this the apex which is present here. It get articulates with the another vertebra which is known as a coccyx. It get articulated with the coccyx. Now this area which is present in this portion is known as a dorsal surfaces. In this dorsal surfaces, it is irregular. It's not smoother like a pelvic surfaces. In this dorsal surfaces, there is a present crest. This is known as a crest, which is known as a median crest. Now this median crest is formed by the fusion of the spinous processes. When you go to the laterally, there is a present one more crest that is present. This crest is known as a intermediate sacral crest. When you go more laterally, there is a one more crest that is present. This crest is known as a lateral crest. Now this median crest fuse together, this portion that fuse together and forms this hole which is known as this portion is known as a sacral foramen. It is also, it's known as a sacral canal. It is a continuation of the vertebral canal which is present in the other vertebra. Now then after that, you have this articulating part which is present here. This is known as a superior articulating facet. When you move downwards, the inferior articulating facet will lead to the formation of the corner. This corner is known as a sacral corner. Now, the lamina of this fuse together and forms this crest which is known as a median crest. Whereas the fifth sacral vertebra lamina doesn't get fused and forms this area which is known as a sacral hiatus. In the posterior, there is a present this foramen which is known as a dorsal sacral foramen, or it's also known as a posterior sacral foramen. Now, when you go to this area, you can see there is a present this portion, as I've already told you, this portion is known as a lateral mass, which get articulated with the hip bone and form the sacroiliac joints. Now this ventral surfaces, now you can see this area, the upper part of it will look forwards and it is forming an angle which is the 30-degree. After that, this first sacral vertebra get articulate with the fifth lumbar vertebra, then it forms an angle which is known as a lumbosacral angle. Now that lumbosacral angle which is formed is almost 210 degree. And this finishes the gross part of the sacrum.